Dr. Ben here. I'm a licensed physician using integrative approaches in psychiatry. This is for educational purposes only, and I can only become your doctor through an official appointment in my practice. Can NAC improve OCD symptoms? What are all those letters I just said? Let's start simple and define OCD. It stands for obsessive compulsive disorder. It's a chronic mental illness affecting 1 out of every 40 people worldwide. It consistently ranks in the World Health Organization's top 10 most disabling illnesses. Sadly, it's often misunderstood. It centers around intrusive thoughts, which means they appear out of nowhere and are hard to shake. These thoughts play on loop and overwhelm the mind with distressing content, even as images sometimes. Common categories are contamination, like worrying about illness or germs, need for symmetry or rightness, such as counting only to even numbers, feeling responsible for harm, such as checking the lock multiple times, or unacceptable thoughts, such as those that seem taboo or immoral. Compulsions are attempts for our mind and nervous system to get rid of these thoughts, though they often make things worse or unmanageable. For example, someone may repeat washing their hands for over an hour only to feel more anxious for following those obsessions. The distinguishing factor here between a personality trait of obsessiveness and OCD itself is that a person with OCD has obsessions that are out of their control and that they neither agree with nor control. It is like being a prisoner of one's mind, told what to do to make the noise quiet down. So what can someone do to quell such dismay? NAC, or N-Acetylcysteine, may alleviate some of these issues for 2 reasons. It is a modified amino acid, aka a building block of proteins. When ingested, NAC increases the brain's main antioxidant, glutathione, by 30 to 40%. This process acts to neutralize free radicals as well as calm down inflammation of brain regions. Importantly, NAC gets the brain to the right temperature when it comes to a chemical called glutamate. This molecule acts as a neurotransmitter, helping brain cells to talk to one another. Normally, glutamate turns cells on, and sometimes this process goes haywire. NAC helps rebalance glutamate activity, and as I'll mention later, the body responds by recalibrating in a short time. In 2025, a respected journal called JAMA found that NAC had similar effects to 4 medications all affecting glutamate, including topiramate, memantine, lamotrigine, and riluzole. Both medicines reduced symptoms by 13 to 16%, but NAC had fewer side effects, the main one being that NAC can upset the stomach without being taken with food. In OCD, add-on NAC demonstrates small but consistent reductions in symptom severity, with effective doses generally ranging between 2,400 and 3,000 milligrams per day. Splitting this up into morning and afternoon doses is typical, and that may be the sweet spot. These effects are only consistently shown between 5 to 8 weeks, so cycling NAC use may be needed to maintain that glutamate balance I mentioned. Taking a 2-week break may be necessary for maximum effectiveness in OCD. This is made all the better when you learn what I shared in an article I wrote in medical school all the way back in 2017. NAC has evidence in reducing cravings for several substances in substance use disorders, particularly ones that are hard to treat, and it may even help in fingernail biting, hair pulling, and skin picking. NAC's main medical use is actually in acetaminophen overdoses and breaking up mucus in the lungs. There are many uses for this remarkable amino acid. Usually, antidepressants like sertraline are used in high doses, and other medications are added in later. NAC can be an option with fewer side effects and some benefits, perhaps when starting a more potent add-on medicine like memantine or risperidone. It may buy a window of relief for those with OCD. Exposure therapy, known as ERP, is the gold standard therapy that's been shown to be very effective. It is challenging and forces those with OCD to face their obsessions without reacting through compulsions. NAC is something to discuss as this vital therapy is undertaken. It takes a lot of courage to do this therapy, and it's important to feel empowered by taking ownership of your health. I'll attach links to the International OCD Foundation and the studies I've mentioned. In integrative medicine, physicians only make claims backed by science. We can't promise the world, but we want to use holistic methods and behaviors to make standard medical treatments work better. It has to have science to back it up, not just hearsay and rumors. I'll end with this. Understanding OCD, finding medicine that helps, and undertaking therapy is a majorly challenging process. You don't have to go it alone, and integrative medicine can aid you on your healing journey. And remember, when you make time for your health now, you'll be grateful later. Farewell.